So there's an interesting question. So do unhealthy toenails actually have tonsils? Oh, I thought toenails. I was going to answer that.
This is why you have to write legibly.
Tonsils. So it's a great question. Do unhealthy tonsils or toenails, I can actually answer that as well, affect your kidneys? In fact, infections that are chronic, so if you get chronic tonsillitis, that actually sets up an immune response in the body. And there are a group of people who are very susceptible to that, and they often get a condition called IgA nephropathy. What they found is that taking out the tonsils doesn't actually help, but stopping the recurrent tonsil infections does. It's especially true in younger people. But chronic dental disease, like bad gums, and infected toenails, that's why I didn't think it was, I thought it was actually a very interesting question. So any chronic infection sets up an inflammation. And as I told you, the kidneys like a bit of a sink and a filter. So it will see all those markers of inflammation. And if they see it for long enough, it'll actually set up a little response. It says, oh, you're trying really hard to fight this, and then it gets mixed up and it starts to make scars in the kidney. So chronic infections can be bad for the kidney.
What causes kidney stones?
Sometimes we don't know. There are certain kinds of kidney stones that are caused by too much, that your body doesn't handle, your kidneys don't properly handle calcium and oxalate and things that make up the stones. Mostly those are found in things like rhubarb and tea and chocolate, and not drinking enough water. And usually the cornerstone of what, if you've ever had one kidney stone, is to actually drink more than 2 liters a day of water, not of pop or anything like that. So there's familial susceptibility to kidney stones. Many people have a kidney stone once, which is excruciating. They never have one again. And then about 30% of people will have another episode, and a very small percentage have recurrent stones. And often your doctor will investigate why and then give you some dietary advice. But the cornerstone is always to increase how much water, plain water, you drink.
I just learned that you are wearing a microphone,
Therefore,
and I couldn't see it on your suit, so I will ask you to sit down and relax, and I will.
And you're going to just sit.
I'm just going to, yeah. Do you want your glasses? Okay. All right. Yep. So low calcium related to a parathyroid problem, high phosphorus. When should one be concerned about elevated phosphorus?
So it's a great question from someone who obviously either has kidney disease or knows somebody. Oh, see. I'm better off in the other place. Okay, I'm coming back. Can you hear me now? You're having a technical difficulty? I thought we put it on. Okay, on the right. Technical difficulties, quickly fixed. So phosphate is in tons and tons of food. Our bodies regulate the phosphate within a very, very tiny, narrow level. Most of us, there's lots and lots of studies now in the general population as well as the kidney population that if your phosphate level is at the upper limit of normal, for a long period of time, that's probably not a good thing and is a very subtle sign that your kidneys don't get rid of it well enough. So, you know how everybody says everything in moderation is good? So everything in moderation diet-wise is good. So phosphate-rich foods are things like potatoes and animal proteins and peanuts and what else? Legumes and things like that. So you have to speak to someone. But most people, unless they have kidney disease, actually can eat and get rid of phosphate without any trouble. Does that answer the question, as one might want to?
Can a person have healthy kidneys their entire life?
Absolutely.
That was easy. Okay. Through good diet and exercise, is it possible to reverse the number or like the GFR from moderate stage to mild stage kidney failure or kidney dysfunction? So
it's a great question. Sometimes you can, but if you even maintain your kidney function but at the 45-ish mark, despite the fact that every year you get older, that's in a way like improving. Because in the equation, if you remember, age is in the equation. So what the people that developed the equation said is maybe it's okay as you age to lose a little bit of function. So the short answer is if you actually maintain diet, and we've had lots of people in clinic who come to us with a kidney function of 38%, adopt a proper diet, nothing else changes, they drink a bit more water, they eat the right foods, and all of a sudden their kidney function is 43%. They're still in the same stage, but they actually got a little bit better. So yes, it's possible.
Do psychotropic medications damage your kidneys? For example, lithium, Seroquel, lamotrigine?
So Seroquel and lamotrigine, no. Lithium in susceptible individuals, usually if they actually also have high blood pressure. So lithium can cause a little bit of scarring. Usually if you drink a lot of water and you're on lithium, then that will actually mitigate that. There's also a medicine that many doctors know about, which is a diuretic called a miloride, which helps to reduce the uptake of lithium in the kidneys and stop some of the damage. And most of the psychiatrists who are ordering it know about that, and you can ask them to ask the questions if they don't.
Are there any recommended food groups to keep kidneys healthy?
The same things that keep your heart healthy and everything else. Non-animal proteins, reasonable carbohydrates, avoidance of simple sugars. It's the same advice that most people would get for heart or diabetes.
Okay. And if they say your potassium's high, how important is it to control it?
So most people won't tell you about high potassium unless it's in something, it's over something 5.5. Potassium is really important. Remember I told you how the kidney controls all these things inside the blood so all the cells work right? Well, one of the organs and cells that works better with a lower potassium is the heart. So you can get rhythm problems if your potassium goes too high. And so that's why usually your doctors call you and get excited about high potassium.
So is it true that as a diabetic, if you control your blood pressure and your blood sugar levels very carefully, that you can minimize the deterioration of your GFR or your kidney function?
Yep, that's all the studies have shown that if you have diabetes and you reduce your blood pressure and control your blood sugar, you can mitigate the risk. It doesn't mean it goes to zero, and it doesn't mean that you avoid everything, but you avoid a lot of the other complications as well as reduce progression of kidney disease.
So this person's asking about his situation or her situation, who's lost one kidney to cancer and wants to know, how do I protect the one that's left? Is there a special diet or a way of living? The individual is very active, working and exercising.
So many people lose a kidney either from cancer or from trauma in a car accident or a bike accident and stuff, and live a very long, healthy, productive life with their remaining kidney. Certainly, not smoking, making sure that you have regular monitoring, not just of your kidney function, but of the other kidney, is very, very important. Again, the usual sensible diet, avoiding drugs that might damage the kidney, being super sensitive to not taking anti-arthritis drugs and stuff like that is very important. We have many people in our clinic with one kidney who've had the same kidney function for 10 years. Right? So it can be done.
Can vitamin C, calcium, or other common supplements cause kidney disease?
Short answer, no.
Okay. Is kidney disease in any way connected to bladder infection?
It's a good question. When you're little, if you have especially little girls, if they've got lots of recurrent bladder infections as a little girl, often that can actually cause a little bit of scarring in the kidney. And as people get older, it means they're starting their adult life with less open filters than someone who didn't have lots of bladder infections. When you're older, you've got more resilience, so you don't cause the scarring necessarily. So the most common cause of kidney disease in children is actually recurrent infections, but usually it's because of reflux. It's because of an anatomical problem that little boys or little girls are born with. As adults, it probably wouldn't be unless you got systemic infection recurrently, and then it could cause or add to.
What's the most important diet change one can make to avoid progression of kidney disease?
Sensibly reduce your protein. Eating protein makes your kidneys work harder, and the harder they have to work to excrete and break down the components of protein, the better it is. The worse the scarring occurs. So if you can reduce the protein and have animal instead of vegetable instead of animal proteins, then that's actually the best solitary thing you can do. And indirectly, by doing that, you reduce your phosphate and all the other stuff anyway. So.
What's the relationship between heart failure and CKD?
So remember I told you how the heart pumps 20% of its output to the kidneys? So if the heart's not working well, the kidneys aren't getting nourished properly, so they don't get that 20%. And then they get what we call in medicine ischemia, which is not enough blood flow to the kidney, and that causes scarring. So that's the relationship. And sometimes the medicines that you have to take to keep your lungs dry actually can cause the kidneys to be too dry. And so you end up with this balancing between heart function and kidney function. But the heart doctors are very good at balancing this thing, and when they're not, so when they get into trouble, they're very good at calling us. So it's an important way to balance. But it's wise, the 20% cardiac output that I told you about.
What kind of exercise is good for kidney failure?
Any exercise. The better you can make your heart, right, the better preserved the blood vessels and your kidneys will be. So there's really no exercise that's bad for your kidneys. Except don't take all those supplements, okay? Like, don't be taking those creatine supplements and all those things. Those are bad.
So this individual describes a scenario where he or she has had a kidney stone attack 2 times because they were told that their body produces too much calcium oxalate, is also taking allopurinol pill, and wondered when they could stop taking medication and what they shouldn't eat or drink.
So firstly, I can give you advice, but I'm not an expert dietitian. But if you have calcium oxalate stones, the recommendation is, as I told you before, rhubarb, tea, chocolate, peanuts are high in oxalate. So you reduce your oxalate intake. You increase your water intake to greater than 2 liters a day. The allopurinol is a good medicine, so I wouldn't stop that. It's good for lots of different things and probably also for preventing kidney scarring. But I think I'd ask for a referral to a dietitian to help do a proper diet so you don't not eat the right things and avoid good things, because sometimes people, when they try and manage their own diet, can overdo it one way or the other. And there are lots of dietitians at St. Paul's in the outpatient lab that actually can give you a sheet of things with oxalate and calcium. The calcium is actually not the problem. The problem is the oxalate, and so that's what you have to fix. Oh, my goodness.
It's a very curious group. So this individual is studying at UBC and drinks coffee frequently, especially during exam period.
So do we.
Yeah, we drink. The question is, does drinking coffee, which contains ADH? I'm not sure what that word is.
Yeah, I think he's saying ADH.
Will it cause any problems to my kidneys?
No.
She knows because she drinks
lots of coffee. No.
Okay. Is it okay to drink 1 liter of water as soon as you get up in the morning?
Sure, if you can do it. I can't do it, but if you can do it, go ahead.
If you've had kidney stones, can you still donate a kidney, alive or dead? If yes, what should I do now, especially if they're thinking about the future and being a
kidney
deceased
stones
donor?
is not a reason not to donate a kidney, either way. Kidney donation is something that people undergo, and they have a lot of tests to make sure they're super healthy. Kidney stones is not a reason not to give a kidney, but if there's scarring on the kidneys, then we wouldn't be able to take your kidney, but it's not a contraindication at all.
So we've covered coffee. Now the question is tea. Is that hard on your kidneys?
Well, for the oxalate person, yes. For the person that has calcium oxalate stones, it's a problem because there's a lot of oxalate in tea. However, tea by itself isn't necessarily a problem.
Can a protein drink, or like the powder, is that okay to drink?
No. Short answer. Don't, unless there's a very good reason that you're malnourished or trying to get over from cancer or something. There's really no good reasons to drink a protein drink. Food is much better than protein drinks.
And
they
probably
have a lot
less expensive.
Less expensive, and there's also lots of there's sugar and other fats and things in there that may not be totally healthy for you. But if you have a medical reason that your doctor's prescribed, that's different. But those ones that you can just buy at the store, I mean, those bodybuilders also shouldn't be drinking them, but they are. But
are there any other questions that you'd like to?
What about Ensure and all those, what they
Again, if there's a
wanna
medical,
repeat the question?
so the question is, what about Ensure? Well, that's one of those protein drinks. If there's a medical reason to be taking Ensure, that someone has or Boost or one of those things, and someone's prescribed it for you, they've often done it because they've looked at your blood tests and they actually know that it's safe. And they've obviously done it because you're unable, or the person's unable to eat enough protein to keep them healthy and well. Usually, people don't need those things forever. They need them for a period of time to get over an acute illness or some therapy that they were having. But for, quote unquote normal, no, none of us is really normal, but for regular people without any kidney problems, to drink high protein drinks just because is probably not necessary and potentially not a good idea. If the dietitian has ordered it because someone is having difficulty eating because of the taste problem and everything else, very different. So when it's prescribed, but we don't sanction people to on their own increase their protein load that way. If a medical team member has prescribed it, it's because that person needs it. Absolutely.
I'm just going to use these questions first. Do you want to? Can waist pain or lower back pain be a sign of kidney disease?
Not so much waist pain. And again, your kidneys are here, not here. So lots of people think that this pain is kidney pain. It's usually not. It's really mostly if it's higher up. When you have a stone, the pain, for those of you who had stones, the pain starts here and radiates around like the sharpest pain. For the women that have ever had children, apparently it's worse than childbirth. That's how you know it's a kidney stone. And for the men, you think you're going to die. So that's apparently what it feels like when you have a kidney stone. But it's got a very clear trajectory, and it's not diffuse chronic pain for a stone. Very rarely does, and I should have said this, kidney disease by itself doesn't usually cause aching of the kidneys.
Okay. If I get kidney disease, should I lessen water intake?
Not necessarily, and that should be discussed with your kidney team. Most people don't need to reduce their water intake unless they've got problems with their heart or they're very much nearing end-stage kidney disease.
Is a vegetarian diet preferable? Should you eliminate all animal protein?
That's a personal choice. Many people would say that if you have no other reasons and you actually like vegetable versus animal proteins, that'd be great. But we're not actually recommending animal protein diets. So I keep vegetarian only, but reduce protein. And then if you have a choice of extra protein, have it as vegetable, not as animal.
If you have osteoporosis and moderate kidney disease, how should you modify your diet?
That's probably the hardest question. The problem with osteoporosis, which is diagnosed, as many of you know, by doing a bone mineral density test, is that the test is not very accurate when you have kidney disease. So you might have lower bones or higher bones or normal bones, but you're going to think that you have low bones density. So that's a problem. You should probably still maintain, because osteoporosis just means thinning of the bones. You should probably just maintain calcium, vitamin D. At a certain level of kidney disease, less than 45 mils per minute, we usually recommend that you do not take a bisphosphonate. And most of, again, the pharmacists and your GPs will know this.
If the creatinine is normal, does it mean your kidneys are normal?
Excellent question. I think Anita and I spent most of our career teaching medical students that that's not true. So the normal range on the lab test goes from 70 to 120. My creatinine is about 58. So first of all, I'm off the lower end, right? But if I came into hospital and it was 100, that would be almost a doubling of my kidney function, but it would be within the lab normal range. It's why we started to do GFRs, the calculation of estimated GFR or kidney function, because that takes into account your age and gender and a few other things, so you can get a much better understanding of whether your, quote, normal creatinine in the lab range is in fact normal kidney function. Does that make sense to everybody?
Can struvite, the thing that's produced for infections, the stones that are made, and chronic infections that cause chronic kidney disease?
Yeah, so it's a great question. So struvite stones are notorious for getting impacted, and they obstruct the kidney. So it's not the stone that causes the kidney disease, the stone obstructing that causes the kidney disease. So usually struvite stones we try and take out.
Oh, controversial for you. You mentioned watching proteins is most important. What about salt? I only have to interject because whenever I eat with her, she takes a salt shaker and just adds salt. So I've outed her. So I'm interested to hear what she says.
So what I say is that even I started to take less salt because I realized. So if you have kidney disease, salt is probably the one thing that if you change, will change a lot of things. So there's some very, very interesting studies where the groups of people who eat salt over the course of their life, if you actually look at their blood vessels at the end of life, they stain for salt within the blood vessels. Oh, wow. And so in cultures where there is no salt, blood pressure does not rise as a function of aging, and there's no salt staining in the blood vessels. So we're learning a lot about salt, and there's a whole thing, you know how Canadians have the highest salt content of anyone. We should be very embarrassed about that. And I had some soup in the cafeteria today, I got to tell you. It's the saltiest soup I've ever had. I didn't have to add anything, but I also realized that... Anyway, so the short answer is salt lowers your blood pressure, is probably good for your blood vessels. And as we learn more about some other things that salt does, including adding to inflammation, it's probably really good to reduce your salt. That's for everybody. I don't care if you have kidney disease or not. We should all have less salt in our diet.
It'll help your heart.
It'll help your heart. It'll help your blood vessels, and it'll help your kidneys. So there's really no reason to add salt, and there's every reason. And the things that even I have learned make things taste better, lemon juice and pepper, and those are things that actually make things taste great, that make you not have to add salt. Ketchup, by the way, is full of salt and full of sugar. So if you don't eat ketchup, but if you have mustard, especially Dijon mustard, that actually has very little additive. But if you get the Heinz variety mustard, that'll also have salt and sugar in it. So what we teach the people in the kidney function to do is to read the labels on stuff. And if salt or sugar is anywhere in the first 4 ingredients, don't get it. And that's one of the reasons that everybody's sort of on to healthy eating and natural foods, because when you buy vegetables and you make your own purees and stuff, then the possibility of having the bad stuff in it goes away, right? And it's ultimately better for you.
If you have CKD and your phosphorus levels are normal, do you still need to restrict intake of phosphorus-containing foods?
Excellent question. Yes, there's some new research that suggests that your kidney is maintaining normal phosphate levels with the damage at the expense of another hormone that goes up, and that hormone can cause scarring. So there's all this balancing that goes on, so it is worthwhile to maintain the restriction.
How does alcohol affect kidney function?
Well, beer has phosphate in it, so I try and tell people not to drink beer. Red wine is good for everything, as you know, including kidney disease. There's something you've heard a lot probably in the press about antioxidants and important things. So wine actually has some of this stuff in it that's really good, and in as much as kidney disease can be secondary to inflammation and other things, actually that antioxidant therapy is good. Hard alcohol is probably not good for anybody, is the truth. And it certainly isn't good for your kidneys. It's not bad for them either, but all depends on your habits.
So what's the effect on the kidneys of taking a single low-dose aspirin, 81 milligrams daily?
Probably nothing. Although if you do have reduced kidney function, there's less evidence that it actually does you benefit, and you may have a higher risk of bleeding, so you'd have to weigh those a little bit.
So you have to look at the reason that you're put on the aspirin in the first place.
Right.
So I think maybe the person missed this. Is kidney disease a hereditary disease? So
in some people it can be, and often a family will know about their hereditary pattern. In other people, so there's a disease called polycystic kidney disease, which you may have heard about, where you get lots of cysts on your kidneys. That often runs in families. But what's interesting is some people can get all out of the blue, though no one in their family had it. They can get the mutation spontaneously, and now they pass it on to their children. So it can be inherited, or some diseases can develop and then be passed on, if that makes sense.
What are the signs and symptoms of kidney cancer.
So kidney cancer, unfortunately, doesn't have a lot of signs and symptoms. Fever, sweats, malaise, those are all pretty nonspecific. New bleeding in your urine or pain can be, it's often found very incidentally. So it's not as easy to find or screen for. Again, family histories of kidney cancer means that you should probably be screened for it.
So what I think I'll do now is thank Dr. Levin for an amazing talk and for entertaining so many of your interesting and challenging questions. And we're going to be around for a little while longer if you'd like to speak to her. We're going to have some refreshments. We have some cookies. Hopefully they're low-salt, low-protein cookies.
There's some cheese today and fruit.
Oh, okay. Even the menu has changed after the summer. Hopefully they're low-salt crackers and low-salt cheese. And fruit, though. We've got the fruit.
And cheese has a lot of phosphate in it, too, even though it has calcium, but that's okay.
That's okay. Tonight it's okay. And it turns out our next session is not until Wednesday, November 17th. And at that time, it's called Let's Talk About Osteoarthritis, which is a very common form of arthritis that many people have. It's presented by one of our rheumatologists here, who's an excellent physician, Dr. Rhonda Shuckett. It will start at 7 on November 17th.
It's now 8 p.m. and visiting hours are now over for this evening. Thank you and good night.
That doesn't apply to you. You can still sit. Okay. So thank you very much, and I hope you'll communicate to your friends. Thank you, Adeera.